I'll be your nurse today. I'll be doing a assessment on you today. So what brings you in here today?
I fell off my horse and I am having some hip pain.
Okay. And the doctor did an x-ray and said it was negative. So can you describe your mobility today?
It's limited. It hurts when I walk.
Okay, in the last 2 months? 2 months ago?
I was fine.
And 2 years ago?
Completely fine.
Okay, are you able to carry out your regular activities since you fell?
No, not really. I'm very sore.
Okay, and do you have any chronic diseases such as diabetes, hypothyroidism, sickle cell, or rheumatoid arthritis?
No. But I do have vitamin D deficiency.
Okay, and please describe any musculoskeletal problems of any family members that you've had.
Both of my grandmas had rheumatoid arthritis, and my mother's mom had osteoarthritis also.
Okay, and so you definitely have a family history of that. Have you ever been diagnosed with any musculoskeletal illnesses?
No.
Have you ever had an infection in the bones?
No.
Okay. Have you ever had any fractures?
No.
All right. Have you ever had any penetrating wounds such as gunshots, stabbings, anything like that?
No.
Okay. Are you having any swelling, heat, redness, or any stiffness that you have in your muscles or joints?
Yeah.
Is it where's that at?
Just mostly in that area
The
where
left hip where you fell. Okay, and how long have you had these symptoms?
Since yesterday.
And what was the cause of this?
Fell off my horse.
Okay, and does the symptom differ at different times of the day since you've fallen?
I think with use, that's when it, being up during the day, it's been hurting.
Okay, and was anything prescribed or recommended to take?
Ibuprofen.
Okay, and was it effective?
It is, yeah.
Okay, have you thought about putting ice on that?
Yeah, he did say that. That's
Okay,
nice.
so I would recommend using ice. And what is your pain level today? Is that 0 to 10, 10 being the worst pain you ever had?
6.
Okay. Is the pain radiating anywhere? Or is it just in that?
It's just in that general hip area.
Okay. Any numbness or tingling?
No.
Okay. Is it causing anything unusual? No. Okay.
No.
Do you smoke or have you ever smoked?
I used to smoke.
And how many packs a day?
2 to 3 packs a day.
Okay. And when did you quit last?
9 years ago.
Okay, that's very good. And tell me about your exercise program.
I do about 30 minutes, 5 days a week, cardio.
Okay, and do you take any medications prescribed or over the counter?
Vitamin D.
Okay. Do you take a multivitamin or anything like that, or thought about that?
No, I do not take that.
Okay, I would recommend extra calcium if you're especially vitamin D deficient. Have you fallen in the last 6 months other than falling off the horse? So on a typical day, what is your diet? What would that be?
I try to eat healthy.
Okay. 3 meals a day?
3 meals a day.
No recent weight loss or gain?
No.
Okay, and how much sunlight do you get a day?
Not too much.
And what kind of work do you do?
I'm a teacher.
Okay. Can you describe your hobbies or athletic activities?
I like to run and, of course, horses.
Okay. And since you're having a vitamin D deficiency, I recommend regular exercise, continue the vitamin D, and then increase your calcium intake. So you do have a higher risk of osteoporosis, especially again with your family history. And we will continue checking your vitamin D levels yearly. And once you're at that age, we will start doing a osteoporosis check. And the left hip, I recommend the ice.
Okay.
Okay. We're going to start your physical assessment. 3. Okay, Melanie, we're going to do an assessment on your musculoskeletal system today. So it is, we're just checking your muscles, your joints, and your mobility to make sure that you have adequate range of motion and good alignment for your activities. It shouldn't be painful. If you have any pain at any time, please tell me. And so I'm going to begin. First, we're going to check your muscle here, and we're going to just assess this. Make sure, are you able to identify it all? And each way. Okay. And it seems to be no pain or discomfort, no walking of any kind.
3.
Alright, well, I'm just going to touch your shoulders, make sure you're even, and I'm just palpating to make sure everything's even, nothing's out of place. What I want you to do is I want you to lift your arms up, and then bring them back behind your back. Okay, it's very good range of motion, it's perfect.
3.
Okay, Melanie, I want you to bring your hands up behind your back. And what we want to see is have a 90-degree angle. So this is a perfect range of motion in this way. And then we're going to bring your arms back like this, and here is another perfect 90-degree angle. So that is very good. Perfect range of motion.
3.
Okay, Melanie, I just want you to stand up supine like this, that's the side, and then I want you to bring that arm up straight like this,
Okay.
and then bring it around like straight there. That's perfect range of motion. Let's do your other arm here. Go ahead and bring it this way, and then just bring it on up. And we're going to turn it this way, and that is perfect range of motion of that shoulder joint. So now I'm going to check your brachial arm here, and we're just going to keep it at a 90-degree angle. And we're going to check this, and I want you to bring this up and down at a 90. And that is like a perfect extension and flexion. Are you having any numbness or tingling or anything?
Mm-mm.
Okay. Are you able to go like this? Okay, and that is a Fallon's test there, and that's normal. Okay, and then I'm just going to check your joints and your fingers. And I'm just going to check this here. Alright, and then I'm going to have you go ahead and bring that arm up. And then back down. Okay.
3.
Alright, Melanie, I'm going to go test your strength here and make sure you can push against resistance if you want to go ahead. Okay, very good. We're going to check this on here. Alright, go ahead and, yep, and I feel even. Are you able to take your wrist this way and then, oh, I hear some snapping, and then this way. Okay, that's very good. Okay. Okay.
3.
Hey, Melanie. What I want you to do is I'm going to hold on to your thumb, and I want you to push against resistance to get your fingers over to your thumb.
Okay. So you want me to pull?
Yep. This way.
Okay.
Okay. If you want to do it this way here. Okay, very good. And I'm going to have you go ahead and stand up there. Are you having any pain, discomfort in there at all?
Mm-mm.
Okay. Any pain or discomfort in here at all?
No.
Okay, very good.
3.
Okay, Melanie, I'm going to palpate your joints there, make sure there's no abnormalities, any bumps or anything. Any pain or discomfort?
Yeah, that's the hip that's very
Oh, okay,
sore.
and that's the, okay. And let's check this hip. Is this one feeling okay?
That one's fine.
Okay. All right, and your legs look even. All right.
3.
All right, Melanie, we're going to test your range of motion. So I want you to bring this leg straight up. Oh, that hurts. Okay. Okay, that is a little bit less than 90, but that is expected. All right, and then we're going to do this to this leg. Perfectly 90. Okay. And then with this same leg is I'm going to have you go ahead and bend this up. All right. And then I'm going to have you come up and bend against resistance with your knee bend. Go ahead and bend against the resistance. Very good. Okay, then I'm going to have you do the same with this one. Go ahead and push against resistance. Very good. Still have good strength in it though. Are you able to take this this leg and go out like this and then back in? And then I'll get out of the way here a little bit. And this is just checking your abduction and adduction. Okay.
3,
Okay, Melanie. What I'm going to have you do is I'm going to have you go ahead and just bend your knee, put your leg on the floor, and I just want you to just check your flexion and extension there, and go ahead and relax this leg, and I'm going to do with your left leg. How is that doing since you're...
It's hurting.
Okay, and just tell me if it just
That right
hurts
there, that's
too
all the
much.
further I can go.
Okay, that is... Right. Okay, can I have you roll towards me and lay on your abdomen
Okay.
in the prone position? Good, sweet, very good. And what I want you to do is go ahead and just bring this leg straight up. Okay, are you doing okay?
Yeah, that's my sore hip.
Okay, and then we're going to do the same with this one. Okay. All right, Melanie, if you could roll towards me, I'm going to have you go ahead and go back
Turn
to
this
yours
way?
on your back for the supine position. Okay, and I'm just going to have you go ahead like this, and I'm just going to check your knees here, make sure there's no embellishment or anything, and then I'm just going to check for any kind of bulging or any fluid collecting, which there is not, which is very good. Okay. Okay, Melanie, I'm just going to check out your ankles, make sure you don't have anything bulging or any extra fluid or anything. And what I'm going to have you do is I'm going to have you plantar flex, okay? And if you want to dorsiflex this way, which check your chest. And then I want you to do, go ahead and push resistance against there.
Okay.
All right, that's even, very good. And then I'm just going to have you invert your foot. And invert your foot, very good. And I want you to do the same on the other one. Invert, and then exvert. Okay, that's very good.
3,
Okay, Melanie, I'm going to check out your spine, the cervical, which is nice and straight, no lumps or crumbs. The thoracic seems to be good, and so is your lumbar. So what I want you to do is I want you to go ahead and bend over at a 90-degree angle. Okay. Maybe up a little bit. Okay, very good. And then you have a little bit of a curvature there to your thoracic spine there. Have you had that for a long time, or is that something you just noticed?
Something I just noticed.
Okay, I'm going to have you go ahead and stand up. Any pain or anything? Okay, and then what I want you to do is I want you to stand here like this, and then just kind of go like this. Just a slight. Okay, and then we're going to go to the other side. Okay. Alright. And...
3,
All right, Melanie, for our last test, what I want you to do is I'm going to have you just bend sideways just to test the flexibility of your spine.
Okay.
So if you want to go ahead and bend this way a little bit, and this way. Any pain, discomfort?
No.
Okay. Well, it was nice having you come into the office today. You passed with flying colors. If you...
Okay.
On your way out, we will give you the prescription then.
Okay.
Okay, Melanie. So, what I want you to keep doing for the vitamin D deficiency and with that left hip bruising, I would like you to recommend the regular exercise just to keep your bones in good shape there with continuing the vitamin D and the increased calcium. So I recommend a multivitamin with calcium in that. I'd also like to check for osteoporosis at your appropriate age, saying that you're a little young right now, but we'd like to keep up on that. And also, we will be checking your vitamin D 6 months to a year. So on your way out, we'll set up an appointment and keep that left hip iced, 20 minutes on, 20 minutes off, and continue the ibuprofen.
Okay.
And do you have any questions?
Should I rest, or can I still continue about my daily activities?
A little bit of rest is good for that. And when you ice it, and that I would recommend a little bit of rest till that is more healed.
Should I use an ice pack or regular ice just out of the freezer?
You can use either an ice pack wrapped around a towel, or you could use ice in a plastic bag and just wrap a towel or something around it as an alternative to buying something. It's a lot cheaper.
Oh, okay. So every 20 minutes?
Yeah, 20 minutes on, 20 minutes off.
Oh, okay.
Do you have any other questions?
Should I continue to take my Motrin?
Continue to take your Motrin, and then just as the pain gets a little better, cut back on it because with liver functions and everything.
Oh, okay.
Okay.
All right.
It was nice meeting you.
You too.